February 3rd, 2010. From the day my son Joshua was born, we have been on an adventure. Due to low amniotic fluid levels, my labor was induced and Joshua was born by cesarean section at 2:15 a.m. He weighed only 5 pounds 6 ounces, so small that he fit into premature clothes for over a month. What alarmed the doctors about Joshua's appearance at birth were the tiny red dots, or petechiae, that covered his face. After doing initial blood work, the hospital found that Joshua's white blood cell count was high and placed him in their special care unit for 7 days and gave him IV antibiotics. 2 weeks after leaving the hospital, I was called by them. This is when they gave Joshua his diagnosis of congenital Cyto Megalo Virus. Since then, we have seen over 15 doctors and therapists, most on a continuous basis. What is Cyto Megalo Virus? CMV. CMV is a virus that affects the majority of American adults by age 40 and is also the most common cause of childhood disabilities and birth defects. Regular CMV infection is common in the human population, and most individuals are eventually infected. Persons with symptoms have a mononucleosis-like syndrome with prolonged fever and mild hepatitis. Once a person becomes infected, the virus remains alive and usually dormant within that person's body for life. CMV infection is essentially a concern because of the risk of an infection to an unborn baby. Congenital CMV is a major public health concern. CMV causes serious neurodevelopmental problems, including mental retardation, cerebral palsy, and hearing loss. The pathogenesis of injury to the developing fetal central nervous system is unknown. CMV infection of placental cells may also contribute to congenital CMV infection by altering placental formation, ultimately resulting in placental insufficiency. Between 30 and 50% of women of childbearing age in the United States have never been infected with CMV. In the United States, about 1 to 4% of uninfected women have a primary CMV infection during pregnancy. About 33% of the women who catch CMV for the first time while pregnant can pass the virus on to their fetus. And about 1 in 150 children is born with congenital CMV. In the United States, about 40,000 children are born with congenital CMV each year. 1 in 150 children in the United States is born with or develops permanent problems due to congenital CMV. In the United States, more than 8,000 children each year suffer permanent problems caused by CMV infection. About 80% of babies born with CMV infection never have signs or symptoms. Joshua has been extremely lucky on his symptoms because he is very high functioning for having CMV. However, he has always developed late, learning to sit up at 9 months and crawl at 10 months. Because of Joshua's low neurological development, he has low tone, causing him to have poor coordination and almost no balance. At 22 months, Joshua still can't walk and falls over constantly. He wears a helmet to protect his brain. CMV is currently the leading cause of non-hereditary hearing loss in children. The infection is associated with 10 to 60% of all hearing loss in children. Joshua was born with a moderate hearing loss in his left ear and a mild loss in his right ear. We have a hearing aid for the left ear, and he also wears glasses for farsightedness. Other problems caused by CMV can include jaundice, large spleen and liver, low birth weight, mineral deposits in the brain, seizures, and small head size. CMV is a member of the herpes virus group that is characterized by the ability to remain dormant within the body over long periods of time. Infectious CMV may be shed in bodily fluids, urine, saliva, blood, tears, semen, and breast milk, intermittently, without any detectable signs and without symptoms. Virus shedding in the urine can be detectable until 10 years of age, with the mean expected time being 4 years. In addition, between 15 to 70% of children acquire CMV infection in group daycare settings and continue to shed the virus for 6 to 48 months. CMV infection is readily transmitted to the pregnant mother at mucosal surfaces via infected urine, saliva, or other bodily fluids. Sexual activity is also an important mode of virus transmission in women of reproductive age. CMV can be readily isolated from the genital tracts of both sexes. The best way to prevent transmission of CMV is to wash your hands often with soap and water, especially after changing diapers, feeding a child, or wiping a young child's nose or drool. Also, do not share food, drinks, or eating utensils used by children. Do not put a child's pacifier in your mouth, and clean toys, countertops, and other surfaces that come into contact with children's urine or saliva. I have no idea what is in store for the rest of our adventure. It has been challenging yet exciting, and each small step Josh takes is a milestone in his development. With all the resources we've been seeking since day one, I plan Joshua to live a normal life.